Good morning. Welcome to today's Workforce Wednesday webinar. I'll be your moderator and technical support for today. My name is Antonio Gomez. I work for the Illinois Center for Specialized Professional Support based out of Illinois State University. If you have any questions or if you have any technical problems, go ahead and drop those in the chat and I can help you out with that. I'm enabling everybody to be able to drop in the chat right now. So the chat should be open. If you have any questions, feel free to drop them there, but they do tend to get lost in the chat. So we do also have a Q&A function if you would like to drop your questions in there as well. I'll be minding both of those. And there are set Q&A portions throughout this webinar in order to be able to address those questions. So once we get there, you'll be free to raise your hand virtually, and I will give you the ability to unmute yourself, and then you can ask your questions out loud as well during those Q&A portions. This webinar will also offer closed captioning, so feel free to turn that on. We will also be recording this webinar, and the recording and all materials will be available within 2 business days on the Illinois Workforce Academy, and then after that on WorkNet. So I will also let Title I folks know that there will be a Title I specific webinar on January 8th that we will answer a little bit more Title I specific questions. So stay tuned for that. And I'm going to get us started with a couple of polls. So our first poll is, what location and which partner do you represent? So I've go ahead and launched that for you guys. We'll give a couple of seconds to get some answers, and then we will share the results. Got quite a few answers coming in. Thank you very much for your participation. We'll give it a couple more seconds. All right. It looks as though we've got quite a few Title I folks, so we'll see you again later. Title II, Title III as well. We've got a few and a few Title IV and other stakeholders and partners. We've got a decent amount of Chicago, a good amount of Northern, good amount of Central, good amount of Southern. So thank you very much for being here. And without further ado, I'm going to go ahead and hand it over to Sheena to get us started.
Thank you. Good morning, everyone. Thank you so much for joining this webinar on the Supplemental Nutrition Assistance Program, SNAP, Federal Impacts on Illinois with the Illinois Department of Human Services, IDHS. So my name is Sheena Pnor, and I'm the Associate Director of the Office of Workforce Development here at IDHS. And our office oversees 2 key programs, the SNAP Employment and Training Program and the Temporary Assistance for Needy Families Employment and Training Program, known as TANF-ENT. And so we are honored to be working alongside all of you in connecting Illinoisans to economic mobility. And our focus in my office is on those low-income households. Both programs are designed to support those individuals by obtaining skills, training, and supports to obtain living wage jobs and a career path, and of course, to meet local and state workforce needs. So I'll be your host today as we walk through the recent federal policy changes that are impacting SNAP in Illinois with a focus on the expanded work requirement and time limit for individuals identified as able-bodied adults without dependents, or ABODs, under federal SNAP policy. And so our goal today is to explain when the SNAP work requirement and time limit will take effect, who will be impacted, what is required for those ABODs to maintain SNAP eligibility, and how we at IDHS are responding through outreach to SNAP recipients and engagement with our partners, including all of you, to support those who may be at risk of losing their food assistance as soon as May 2026. So as Antonio mentioned, just a couple of housekeeping notes that I'll pause at 3 different moments in the presentation to be able to answer your questions. Those that we're able to answer in the moment, we definitely will do so. And anything that we're not able to answer today, we'll pull into that frequently asked questions document that we will compile responses and share with you all as soon as we have that clarification that we need to share with you. So next slide, please. So we'll start with a quick overview of SNAP. It's the program formerly known as food stamps, and it helps low-income people and families buy the food they need for good health. Benefits are issued on the Illinois Link Card and can be used at most grocery stores. Eligibility for SNAP is determined based on income, expenses, and household size, and some other factors. And in Illinois, households may qualify with income up to 165% of the federal poverty level, or up to 200% if the household includes an elderly or disabled member. And the program is federally managed by the U.S. Department of Agriculture and locally administered by us at IDHS. Eligibility workers at those local DHS offices, known as Family and Community Resource Centers, or FCRCs, are the ones who determine eligibility for SNAP. Next slide, please. So in Illinois, we have one of the largest programs in the country, issuing more than $4 billion in SNAP benefits every year to nearly 2 million people. Many of our SNAP households include older adults, children, or people with disabilities, and this also includes more than 44,000 veterans. And the next slide, please. And so the expansion of the SNAP work requirement will directly impact more than 340,000 SNAP recipients who are at risk of losing access to their food assistance. This in turn could result in wage losses of up to $1 billion annually across Illinois industries along the supply chain from farms to table, which also threatens $7.2 billion in positive economic impact for Illinois. And have a compounded impact on more than 1.7 million Illinoisans who rely on both SNAP and Medicaid. And so with these numbers, what we want to stress is that cuts to SNAP not only affect our food insecure households who no longer have that purchasing power to buy, to put food on their table, but also has an effect, from farms to retailers, all the way across that supply chain, because again, increasing purchasing power for our SNAP households helps to stimulate our economy as well. So that's why we just wanted to stress the importance of the program on those multiple levels, and the real risk to our people, families, and communities as a result. Next slide, please. So as you may know, on July 4th of 2025, the federal government passed H.R. 1. And in addition to the changes to the SNAP work requirement and time limit that we will be going to in more depth, also wanted to let you know that H.R. 1 requires states to cover part of the SNAP benefits based on their payment error rate, which could cost Illinois over $800 million starting in 2027 and is a significant threat to the program. So while Illinois has a relatively low error rate, we are taking steps, working hard to do what we can to reduce our payment error rate even further through some policy changes related to documentation and renewals that you'll be hearing over time, and encourage you to stay tuned for more information sort of related to some of these other impacts as a result of H.R. 1. Next slide, please. So today, though, we will focus on the impacts to our SNAP recipients who are identified as able-bodied adults without dependents, ABODs, who are facing this expanded work requirement and return of the time limit. So in the next few slides, I'll give an overview first of the policy and exemptions, and then pause for questions. Then we'll talk about how an ABOD can meet the work requirement, pause for questions at that time, and then we will talk about our plan for working alongside all of you and our workforce partners, and then have questions there. So just want to let you know this first section will be an overview of the general policy and the exemptions. Next slide, please. So here we just wanted to highlight what changed through H.R. 1. So H.R. 1 increased the age range of those who are identified as ABODs. It used to be 18 to 54-year-olds, and now that's up to 18 to 64-year-olds. So now those 54 to 64-year-olds are also potentially subject to the work requirement. Before, the time limit did not apply to adults that were in the same SNAP household as a child under age 18, but H.R. 1 changed this so that the exemption only applies to those who have a child under age 14 in their SNAP household. Before, there were automatic exemptions for individuals who are homeless, veterans, youth aging out of foster care. After H.R. 1, those individuals could still be exempt for another reason, but they will not be getting that automatic exemption based on their status. And we'll go through the full list of exemptions that are still in place later on. The HR 1 also changed the threshold for requesting time limit waivers. As you may know, Illinois has been under a waiver of the time limit for a number of years. Our current waiver goes through end of January. And because of the change in the threshold for requesting these waivers, we no longer meet that threshold and we don't have that ability to request a waiver when our current waiver expires. Next slide, please. Here, we wanted to share that of our almost 2 million SNAP recipients, about 20% of them are identified as ABODs. And of those ABODs, our data shows that about 80% may be at risk of losing their access to SNAP because we didn't have documentation at the time of this data poll that they were meeting it. So again, of our ABODs, we saw that 20% may already be meeting the criteria to show that they're meeting the work requirement, while 80% were not. And those individuals are the ones that are at risk that we are focusing on. Next slide, please. So when there has been research done on the characteristics of the ABOD population to better understand their needs and who we're looking at under this criteria, and wanted to share some of that context for you all. Of course, please note this research was done before the expansion of the definition of ABOD. So this is only those 18 to, at the time this was done, it was 18 to 49-year-olds, who didn't have someone under 18 in their household. So with this expansion to these new households, there could be some changes to this, but wanted to share what we know about what ABODs have looked like across the country. So oftentimes, we've seen that our ABODs are managing multiple crises like food and housing insecurity, mental or physical health issues. They might be connected to low-wage, unpredictable jobs. They may be disconnected from, traditional communication, so they might have not have a consistent mailing address or phone number or email address. And those in rural areas in particular may be disconnected from any options nearby for service delivery. And what we've seen is research shows that the SNAP work requirement and time limit reduces SNAP participation, but has not been shown to increase employment or earnings. And so we recognize, that these individuals are often facing a lot of barriers, a lot of challenges. That's the reason that they may not be employed or connected to a training program at the time. They're doing the best. They need support, they have those barriers, and that's our challenge to, one, focus on educating both our SNAP recipients and our partners on all of the allowable exemption pathways, because some of the factors we just talked through may mean that person is actually exempt and would not have to meet the work requirement. And so we want to make sure that first and foremost that we're helping individuals connect to those exemptions if they meet them. And then those who are not exempt, really trying to help them connect with the right services to meet them where they're at and to meet the work requirement. And here I will pause and turn it over to my colleague Julio Rodriguez from DCEO.
Good morning, everyone. My name again is Julio Rodriguez. I'm the Deputy Director for the Office of Employment and Training at the Illinois Department of Commerce and Economic Opportunity. And we are delighted that we're actually working with our colleagues at the Illinois Department of Human Services, and Sheena and our team and their team have literally been meeting, it feels like daily, but what has been great is we have really been looking at ways that we can not only address the immediate need, but really talking about what are the long-term things that we can do that will really exemplify the work that Illinois is doing to not just ensure that folks continue to get their SNAP benefits, but also hopefully start people on a career path and to get them the types of training and resources they need to attach to ongoing and more secure employment. So that being said, for those of you who are on the call who are Title I providers, and that means both our local workforce areas as well as our subcontractors who are WIOA providers and Title I services. I think it's important to remember that the ABOD population has always been a priority population under WIOA. They fit the priority of service framework. Many of them, as Sheena mentioned, fall under the categories of people under public assistance, people with multiple barriers, such as, both mental health needs, addiction, and unstable housing. That matters because one of the things in the new law is that Title I services are specifically called out as being one way to meet the work requirements. And as Antonio mentioned at the beginning, we are going to have a separate webinar for folks in the Title I program to really talk about not only how that priority of services gets met, but also what are the implications as it relates to performance and how do we manage both meeting the needs of the ABOP population as well as ensuring that we continue to make our WIOA performance targets for the state. I wanted to also just make sure that we at least initially tell you what our plans are for addressing some of the more immediate needs of the population. And one is that we are going to be using a virtual first access strategy. For many of you who are in the system know, we have the Illinois WorkNet platform. We'll be using that platform as the mechanism for being able to offer virtual services and then able to track and engage participants in order for them to meet the work requirements. This is a sort of clear sort of step up priority of service customer staff, assisted navigation. It also ensures that we're reaching as large a number of people as we possibly can immediately, and also setting them up for those that it makes sense to get engaged with the Title I programs in a much more comprehensive way. So that's where we are right now, and I'll jump back on a little later in the presentation. But we're very excited that we have this opportunity to really bring the two systems together in a much more intentional way. I'm turning it back to you. I feel like a reporter.
Thank you, Julio. And again, so grateful for working hand in hand with DCEO, again, to look at how many ABOTs we have, and how we can connect them to opportunities to meet. So, and again, as Julio said, we'll be sharing more information on that later in the presentation and definitely in the weeks to come. Next slide, please. So with the return of the ABOT time limit, here's a summary of what you need to know. So the time limit will return in Illinois on February 1st, 2026. That will be the first month where we are no longer under a statewide waiver. The time limit applies to adults ages 18 to 64 who do not have a child under age 14 in their SNAP household. So again, someone age 65 plus, they would not be an ABOD. Someone under 18, they would not be an ABOD. Again, that first criteria is around the age, and it's 18 to 64-year-olds. I have the waiver expires in January, so the time limit, again, will start in February, where individuals who are identified as ABODs can only get 3 months of SNAP benefits in a 3-year period without meeting the work requirement. And we will talk more about what meeting looks like. And so our local IDHS offices, they've already been screening customers for exemptions. We've sent out notices to customers about the changes and what they need to do, but definitely, appreciate all of your help in supporting our customers in knowing what those exemptions are and reporting potential exemptions and helping to connect them to pathways to meet through programs like SNAP Employment and Training, WIOA Title I, and others. And just know that we are developing tools to better help ABODs find programs in their area and provide that clarity to all of you in the workforce system on what programs qualify. We'll get to that in the meeting section around what we're doing around getting clarification on that. Next slide, please. So here, we, again, just have a visual to show the time limit will return February 26th. They can only get the 3 months of SNAP in the 3-year period. But we also want you to know that even if an ABOD gets 3 months, so let's say they get February, March, and April, and unfortunately they lose their SNAP starting in May of 2026, they can regain eligibility. as many times as they meet the criteria during the 3-year period if they become exempt. So if at any time they start meeting one of the exemption reasons we're going to talk about, they're eligible again for SNAP. And if they begin meeting the work requirement and they can show that they met it for, they completed their 80 hours and 30 consecutive days, they can also regain eligibility. So not only are we all really focused on helping them meet to not lose their benefits to begin with, but also for those who do lose eligibility because of getting their 3 months, we can also work together around those strategies for helping ABODs regain eligibility. And when we talk about the 3-year period, the thing to know is the 3-year period runs continuously, even when a state is under a waiver. So that's why in Illinois, our 3-year period actually began January 1st, 2024, and will end December 31st, 2026. So for our purposes, for our ABODs, the time limit comes back in February, and they can't, they will be ineligible if they get that 3 months through December 31st, 2026. But the thing to know is January 1st, 2027, our state clock will reset. A new 3-year period will begin, and all ABODs will again start fresh with no countable months on their record. January 1st, 2027 also coincides with the change HR 1 made in terms of Medicaid work requirement. And so we are working with HFS and our partners also so that we can leverage all of the work that we're doing in alignment with, DCEO and our partners for the SNAP work requirement to also position us well to serve Medicaid recipients when that work requirement takes effect January 1st, 2027. So just flagging that date because given that our ABOD clock, will reset January 1st, all our ABODs have a fresh start, but the Medicaid work requirement will then take effect around the same time. And again, another opportunity that we will be for sure working together to respond to. All right, next slide, please. Here, just wanted to show you the 5175, which is our SNAP work rules notice that individuals who are subject to SNAP work rules will receive from IDHS. So anyone that's determined by the eligibility worker to be an ABOD will get a verbal explanation of who in their household is an ABOD, how to meet, what to do if they meet an exemption or if they have a good reason. And they will also get this notice in the mail at what we call initial certification when they initially apply and are approved, at their renewal, which we also call redetermination, and when a previously exempt household member becomes subject to the rules or a new person joins the household who's subject. But just know that it is required in policy for those who are identified as ABODs to receive this notice so that they know who is subject and they have that information. And we want to make sure that our ABOD customers read and follow the instructions in this notice to avoid losing their benefits. So since we know that some of them might be bringing these into you all, or you might have seen this, wanted to just share that screenshot. Next slide, please. Here with regaining eligibility, I'm not going to go through a lot of these details because we are focusing first, of course, on those first months of when the time limit returns. But again, just want to make sure everyone knows that there are pathways for ABODs to regain eligibility if they become exempt or if they fulfill the 80-hour work requirement for 30 consecutive days, and then they will remain eligible as long as they continue to meet or have that exemption. And then if during their period, they meet the criteria to regain, but then they lose it. So let's say they were in a training program, they regained eligibility, but then they stop. One time in that 3-year period, they can get an additional set of 3 consecutive months. We no need to know all the details except that there may be an opportunity for an ABOD to get 3 additional months if they meet the criteria to regain. All right, next slide, please. Here, just a quick recap. Time limit returns February 26th. ABODs can only get 3 months in the 3-year period unless they're meeting or exempt. They could regain if they become exempt or begin meeting the work requirement. There is an additional 3 set of months for an ABOD who regains and then loses. Our 3-year period ends December 31st, 2026. And so January 1st, 2027, our ABOD clock will reset. All right, so next section, we'll talk through the exemptions, and then we will pause and answer the questions that you all have been sharing in the Q&A and the chat. So, the exemptions, not everyone age 18 to 64 is required to meet the ABOD work requirement. And we want to, again, make sure all of those who qualify for one are receiving an exemption so that someone is not subject to this work requirement incorrectly. So next slide, please. I am going to go through each of these exemptions on here just because it's so important and want to make sure you have the opportunity to ask any clarifying questions about these exemptions. So the first one, as I mentioned, with age, if someone's under age 18 or they're 65 years of age or older, they're not an ABOD. If they are physically or mentally unable to work, including experiencing chronic homelessness, domestic violence, or other barriers, they may be eligible for that exemption for mental and physical barriers to work. And with that one, we want to stress that that doesn't mean they're officially disabled under Social Security or 100% disabled under, Veterans Administration. There is flexibility here if someone is experiencing those challenges related to their ability to gain and maintain 80 hours of employment. If someone is pregnant, they are exempt from work rules. If they are in a SNAP household, meaning they're purchasing and preparing with a child under age 14, they would be exempt. Some Native Americans are exempt. This is actually a change in the definition that was made by HR 1. And then for caretakers, so if someone is caring for a child under age 6 or a person who needs help caring for themselves, and that person could be in their home or outside of their home, but if they are providing care for somebody and this affects, again, their ability to obtain or maintain employment, that could be an exemption reason. Also, if someone's going to school, college, or a training program at least half time, or meeting the work rules for TANF, or receiving unemployment benefits, or they've applied for unemployment benefits, they would also meet an exemption. If they're participating regularly in alcohol or drug treatment program, and this is not AA or NA, but more of an intensive treatment program that would qualify for this exemption. And then the important thing to know is if they're working at least 30 hours a week, they would actually be exempt. So 30 hours is the magic number of hours that actually equals an exemption from the ABOD status and work requirement. Also, if someone is earning at least $217.50, which is the federal minimum wage of $7.25 multiplied by 30 hours a week, that person would also be exempt. And that dollar amount is really key because, and that's $217.50 before any, deductions or taxes are taken out, because in Illinois, given that our state minimum wage is $15, someone working 60 hours at the $15 would potentially meet that threshold and be exempt. So that's the other thing to note is 30 hours equals exemption. And if someone is getting gross income of $217.50 a week, they would also be exempt based on that wage amount, and those individuals would not be ABODs. Next slide, please. We want to share some tools that we have available to help customers and community partners to help individuals who may have an exemption. So here's a screenshot where if someone goes to abe.illinois.gov/access, and this is where our SNAP recipients, if they have a Manage My Case account, would be going to log in. Where you see the red arrow, there's a Check If I Meet SNAP work requirement screener tool, and if you click through that, it will talk through those questions, and you don't have to log in to do that. You can simply enter the information to answer those questions, and it will guide you through and let you know and it will tell the person who's entering the information if they may potentially meet an exemption and the ways that they can request an exemption. And so on the next slide, we're outlining the exemption request process, so customers can request an exemption at any time by contacting their local FCRC in person, via phone call. They can submit the form 2341, which is the request for exemption form, through their Manage My Case account, or they can drop it off. And on the next slide, I believe I have a screenshot so that you can see what that looks like. And they can upload documents directly through Manage My Case, including this form. And this has on it, you can see the list of all of those exemption reasons that we talked through. And this form was also mailed out to those who were potential ABODs. And we have been getting a number of these forms submitted back to us with individuals requesting an exemption and identifying which of those reasons might apply for them. And if you navigate through that screener tool, it will give the direct link to this form as well. All right, next slide, please. In some cases, someone who is requesting an exemption, supporting documentation may be requested by the FCRC. It is the FCRC staff who make that determination on exemption status. So we wanted to highlight that, for example, if someone is unable to work due to a medical or physical health condition and the FCRC asks for additional documentation, we're going to show a screenshot of the Form 2340 that providers like healthcare professionals, social workers, drug or alcohol treatment providers, homeless or domestic violence service providers, or others can use to provide supporting documentation. And so on the next slide, we have a screenshot of that form and wanted to make sure you are aware that that's available. So this is the first form where the customer enters their information. And if on the next slide, we have the second page just showing, there's a lot of flexibility in the different types of providers that can submit supporting documentation to help ABODs with these requests for exemptions. So with that, I will pause at this time to answer questions on the general policy as well as the exemptions before we move on to talk specifically about how ABODs need to meet the work requirement. And so I know, Antonio, you will help me with making sure we get to all the questions.
Absolutely.
All right, I see. How complete is the current data for hours worked per month for SNAP recipients in Illinois for the 81% that aren't currently documented as meeting the work requirement? Can some of this be attributed to missing data? Great question and point. That absolutely some of that may be lack of documentation that they're meeting. Also, we were working on different ways to identify, to pull into that number, also those meeting through different work programs. And so that number is changing. Again, as we've been notifying customers, we have been getting in a lot of documentation as well as exemption requests. So that number has probably changed. We were just giving you a snapshot from that point of time. So great point. So what happens if they start working and only work for 3 months? What happens to the benefits eligibility? So we'll get into the what they need to do to meet the work requirement in the next slide. So making a note that we will come back to that one. All right. Can you explain the nuances around homelessness? I thought that was no longer an exemption. Yeah, so great question. So as I said, there's no longer that automatic exemption that if someone says they're homeless, it's automatic. However, under mental and physical barriers to work, we know, and you all know, right, that someone facing housing insecurity or experiencing homelessness, that can be a very real barrier for them to, interview and maintain and sustain employment. So that is where individuals in those circumstances can request that exemption, and the FCRC will determine if they meet the exemption based on mental and physical barriers to work, as opposed to automatically for their homeless status. So hopefully that makes sense. Feel free to add another chat message, if another question to the Q&A if you have additional questions on that. Can you clarify the 3-year time period? It sounds like this is based on Illinois timeframes, not based on when someone first applies. So correct. So in Illinois, we have just a statewide 3-year period that applies to all ABODs. So even someone who applies on, December 1st of 2026, their clock will also reset January 1st, 2027. Because we have a statewide clock, it's not tied to when people apply for benefits or renew their benefits. It's really just a statewide January 1st, 2027 for everybody, a clock reset. So when an exemption is approved, how often does an ABOD need to renew the exemption? So Um, eligibility workers screen for exemptions when they do their initial certification. So when someone applies and they have their first interview and they're screened at that time to identify if they're an ABOD, and then they will also be screened again at renewal. Now, sort of case by case, if someone were to kind of report a change during the certification period that might affect their exemption status, there could be some of those circumstances where it comes up at that time. If someone's reporting because they're no longer employed, for example, 30 hours or something like that, right? But generally, exemptions are screened for and documented in the system at initial application and then also at renewal. So are there exemptions for those that are 60 plus years and receiving widower's benefits from Social Security? So there is not a standalone automatic exemption, for those receiving Social Security widower benefits. Again, that would be something where the 60-year-old would have to look at that list of exemption reasons that was on that previous slide. And if any of those apply to them, they should, encourage them to request an exemption, but there isn't an automatic one related to widower's benefits. If someone is receiving Social Security disability benefits, that would be in the system. And because it's disability benefits, that would be an exemption. But receiving those widower benefits, not necessarily. Is the 2340 form available online? So yes, our Illinois DHS forms are available online to customers and for SNAP recipients through their Manage My Case account as well. Can volunteer and work hours be used together to meet exemption requirements? So we'll get to the sort of meeting section in the next portion, but I will say yes, the exemption that's for working 30 or more hours is specific to employment and self-employment and not community service hours.
And
All
let me help you
right.
navigate the questions through the chat because they've kind of gotten buried a little bit. So the
Thank you.
first question is, if a person has a baby, how long will they have benefits before they're required to go to work?
So if an individual is pregnant, they're exempt from the work rules. And as long as that child is in their household up to age 13, they would be exempt. So it would only be if, again, there's no child under age 14 in the household, and they don't meet another exemption reason that they would become subject to the work requirement. But someone with a new baby would be exempt. And again, if that child is in their home, they would continue to be exempt up until that child were to turn 14, and assuming there would be no other children under 14 in the household.
Excellent. And the last question, will individuals receiving SNAP currently have to do anything now?
So individuals currently receiving SNAP, again, encourage them to consider if they may meet an exemption reason and to request an exemption. Because if they got a notice that they're an ABOD, they would be subject to the work requirement. So it depends, so in that sense, encourage them to just find out if they're identified as an ABOD or not and consider requesting an exemption.
And we got one more question. If both parents are in the household and have children under the age of 14, are both parents exempt from the work requirement?
Yes. So all of the adults in a household where there is a child under age 14, as long as they're all purchasing and preparing food together and, are in that SNAP household, yes, both parents would be exempt. And even if there are, additional adults in that SNAP household that purchase and prepare food together, they would all be exempt for having if there's at least one child under age 14.
And we got one more question in the Q&A.
Sure.
Do we need to pause this and continue with the presentation and come back to it?
I think we can take one more.
Excellent.
Yeah.
Does Social Security retirement count as an exemption?
So again, unfortunately, that is not one of those exemption reasons, I spoke about was not related to retirement benefits. So that is not, again, an automatic exemption. But if that individual meets any of those reasons that were on that slide, or again, if they click check, if I need to meet SNAP work requirements and one of those reasons applies, they could request an exemption. But, retirement was not on that list. Again, receiving widower's benefits, not on that list. That list is the one based on federal policy. Again, this is not Illinois policy. Those exemptions are all federal policy that we have to be in compliance with. So if it's not something on that list, it's not an automatic exemption. All right. We can then move on to the next section of the presentation on meeting the work requirement, where we will again focus on those who are identified as ABODs, and they're not exempt, what they need to do to meet their work requirements. So next slide, please. And just to reset, so again, ABODs would be individuals ages 18 to 64. They are, quote, fit for employment. I know that that's controversial language, but that's sort of, under the rules, sort of, quote, fit for employment. They do not live in a SNAP household with a child under age 14. And again, that doesn't, it doesn't have to be, they don't have to be parents, right? But if they're in the SNAP household with a child under age, they're living in a SNAP household that does not have a child under age 14. They're not pregnant. They don't meet one of those other exemption reasons we went through, and they're not covered by a time limit waiver or discretionary exemption. And again, starting February, we do not have a waiver, and right now we don't have any of those discretionary exemptions to use in Illinois. So next slide, please. So those individuals can meet the work requirement by completing at least 80 hours per month through work. And work is defined in federal rules as paid work, unpaid work, which, is community service, volunteering, in-kind work, working in exchange, for rent or something else. And so again, working here means paid, unpaid, in-kind community service. Or 80 hours participating in a qualifying work program. And that is, again, per the federal rules, where those qualifying programs are defined as SNAP employment and training. WIOA Title I, as Julio mentioned earlier, that is also very clearly in our rules, a qualifying work program for ABODs. And then other approved federal, state, or local programs. And that is something we at IDHS, we're working with DCEO, IDES, ICCB, all of our workforce partners to really clarify what that list is or criteria for those approved programs. And so again, we're working on getting that internal alignment and clarification to share with you all. But that what's very clear is, again, SNAP employment and training, WIOA Title I, employment and training program for veterans. So like something like the IDES Jobs for Veterans programs, Trade Act programs, those are very clear in the rules as a qualifying program. Or individuals can combine work and work program participation to meet the 80-hour threshold. So while it's not a combination for that exemption that we talked about earlier and that person asked about around the 30 hours, that combination is allowable for an ABOD to meet the work requirement. So they could do 10 hours of paid employment and 10 hours of community service, or 10 hours of community service plus 10 hours of SNAP ENT or WIOA Title I or one of those other approved training programs. That combination of work, meaning paid, unpaid, and kind community service, as well as work program participation, just needs to meet that 80-hour threshold. Now, I do have an asterisk because those of you who may be our current SNAP employment and training providers, we do have an additional option under SNAP ENT that's less hours. It's a program called Workfare. I'm not going into details on it because it's sort of specific to our SNAP employment and training providers, but just put a note here because that's a different pathway that is below 80 hours a month. And here too, let me turn it over to Julio to add some additional context.
Great. Thank you, Sheena. Again, as Sheena mentioned, Title I is one of the programs that is an allowable program. We are working right now as I mentioned, on January 8th, we're going to do a specific webinar for Title I providers to really talk about what are the types of activities that fall under that Title I umbrella. Many of you already are familiar with that. All of our American Job Centers slash Illinois WorkNet centers will be enlisted in this effort. We are looking at various ways to really think about how we can um, filter many of the folks coming in from the SNAP program into the job centers. So we'll be working very closely with IDHS's centers and staff to really align that process. We're also working with, as Sheena mentioned, IDES, particularly with referring people to Illinois Job Link for job search. We're also working with ICCB to really outline the pathways for adult ed programs as well as GED and other services that the community colleges offer and their adult ed providers offer. And again, as was mentioned, veteran services is another opportunity for folks to meet that requirement. And IDS runs those programs, so we'll be talking with them as well as other providers that provide services for veterans. We also are pursuing, as Sheena mentioned, expanding that list of eligible training provider programs. Those would include our JTED programs, the Job Training and Economic Development grantees, as well as CEJA programs, which is our clean energy programs and pre-apprenticeship, our Illinois Works program that works to do pre-apprenticeship programs in the trades. And then we're looking at other state-funded programs that meet the definition of being provided oversight either through state, local government, or other entities. But the idea is to expand as many opportunities for work programs as we possibly can under the state. Um, those qualifying programs will help for us to really not only expand the pool, but also to have more coverage across the state by offering these various programs that we think meet the requirements under the 80 hours and would help people be able to keep their benefits. One other last thing just to mention is, as was mentioned, you can combine work and other types of activities, especially for Title I, that could include on-the-job training with work experience as one example of how to meet that 80 hours moving forward. And again, we're going to also be looking at virtual services and combining both universal services with Title I and other services for us to be able to meet that 80-hour work requirement. Turning it back to Sheena.
Thank you so much, Julio. And I think with that, we can pause here before we get into a little bit more detail on our coordination and pause and allow for questions on that portion as well. Just want to see if there's any questions in the chat related to meeting. I see there's one question, are they exempt if receiving SSI? So again, if the individual is disabled, they could get an exemption. And I think the thing too that I was realizing I didn't mention with all the Social Security questions, though that's something that, in IDHS, in our eligibility system, we have a match with Social Security. So again, if someone is, getting Social Security disability or a program for a disability through Social Security, they will see that and get an exemption that way. And so just know that, again, that's going to be part of what the FCRC staff will be looking at. How will DHS know that someone is collecting unemployment? So again, that's something that will be asked to the individual, as well as I believe we also have data matches related to receipt of unemployment. Let's see.
The last question that was asked in the chat was, how are community services documented? What documentation is needed?
And so in the next section, let me make sure. Yes, I do have a slide with information on how you all can help ABODs with documenting how they may be meeting currently. We are, again, sort of working to see if there's a form that we can provide to make it easier. You're definitely not required to use whatever form we put out, but just as an option to make it easier for you all, we are working on that. But in the meantime, when we get in the next section, I'll share a slide that has recommendations on the kind of information for someone to get that documentation, and that will cover that. All right, then to
And then,
clarify, oh, sorry, go
yes,
ahead,
you got it.
Antonio.
You got it. That's exactly the one that I was going to read.
Okay, to clarify, someone who applies for unemployment via IDES and is engaged in full-time job seeking meets the ABOD work search requirement. So again, with that one, if they've applied for unemployment, they're receiving unemployment, they're complying with unemployment, they're exempt. So they actually, again, are on that exemption pathway. They would not be identified as an ABOD, and they do not need to meet the work requirement because they meet that exemption through applying and receiving unemployment. And Julio, I think there are some questions related to
Yeah,
WIOA in the chat, but I don't know if you want to wait till the next section or if you want to address it now. Go ahead.
On the how does a new organization become a Title I part, that's a lot. We'll answer that questions in the FAQs because that's a much more complex question because it would require you to be working with your local workforce area in order to become a partner under their auspices. But we can address that in the FAQs going forward. And then in terms of using WIOA discretionary dollars to support WIOA, the ABODs, yes, we are looking at that. And we'll continue to see how we can use discretionary dollars as well as state supplemental grants to be able to support the work requirements under the SNAP program.
Thanks, Julio. And then I think,
yeah, there's another one.
sorry, yes, I'll answer this last one and then we can go to the next section. And then, of course, feel free to add additional questions. So are claimants exempt simply from applying to unemployment, or must they be approved? So again, based on the federal rules, a person who has applied for but is not yet receiving unemployment is also exempt if they're complying with those work requirements that are part of the application process. But again, a lot of those policy decisions around eligibility and the exemptions, just please know that the FCRC eligibility workers are the one who determine that and make the final decision. So it's, just make, so it really may depend case by case on that individual circumstance. So I would just say, if there's a question, the individual should definitely ask questions that are FCRC. They can submit that request for exemption form. There's no issue, no penalty, no problem for them to request, right? And ask the question. And then the eligibility worker can guide them based on their circumstances to, make sure to give them the appropriate exemption. So I just encourage you all to help individuals to know to ask, request if there's any question, because they should really work with their eligibility worker to know all of the specific nuances of their case. All right, so moving to the next section. Next slide, please. So now we want to talk with all of you about how we know that supporting ABODs will require that coordinated effort across the workforce system, including our SNAP ENT providers, WIOA partners, community colleges, other state and local workforce partners on this call. We've been talking about that. Our goal really to help ensure that individuals have access to the services they need that meet them where they're at, to meet the SNAP work requirement and to maintain their benefits. So on the next slide, outlining some of the ways that IDHS has been working to prepare. So again, as we mentioned, we are getting out there and trying to educate and engage both our SNAP recipients, applicants, partners on those exemption pathways and the work requirement options, so presentations like today's webinar. 2, we are working to expand our voluntary SNAP employment and training program over time to have statewide coverage and increase the slots under that program. And I do want to also just mention that our SNAP employment and training program will remain voluntary, meaning it's an option for an ABOT to meet the work requirement, but they're not required to participate in SNAP E&T. There are no sanctions for non-participation. Again, they're not required to participate. And I only mention that because some of you on the call may have been involved in years prior where the program was mandatory, and so individuals could be sanctioned if they did not participate. So I just wanted to clarify, even with the ABOD work requirement coming back, that is a separate track. SNAP employment and training will remain voluntary. It's one option for ABODs, but even individuals who are non-ABODs could still potentially access that program. But we are trying to also expand our slots in that program to be able to serve more ABOTs as well. And then 3, you've heard Julio and I speak to this, but we really want to align the broader workforce system to support ABOTs beyond SNAP E&T and really work together on looking at, as Julio mentioned, those pathways that make sense for co-enrollment and blending and braiding funds and sequencing and all of those ways to support our ABOTs. Also, as I mentioned, everything that we're putting in place, we are also really thinking through how that can serve as a foundation for the future Medicaid work requirement implementation, January 1st, 2027. Next slide, please. So this is the slide that I mentioned earlier around verification. And so again, we are working on, tools and potential forms to just make it easier for you all. But in the interim, as we're getting alignment on those things, wanted to share with you, in talking with our FCRCs, the kind of information that would be helpful for you all in submitting documentation and this could be for that enrollment half-time or more in a recognized school training program or institution of higher education, or for an individual who's meeting through work program participation or community service. And so with any documentation that is provided for an ABOT when they're first applying for SNAP, or someone who's on SNAP but is currently an ABOT and needs to show that they're meeting because it's not currently documented in the system, or when they come to their renewal, the documentation should have the customer's name, their contact information, the work program name, and a brief description, or if it's a training program for that half-time exemption, just a name and some details on it, or again, a volunteer site, a brief description of that site and what they're doing there, the date they started participation, anticipated end date if there is one. So for the ABOD work requirement, there's no limit on how long someone can meet through volunteering, or how long someone can meet with the work program, or how long, someone can meet with a combination of whatever of those activities. But this is just that if there is an end date in that program, to include that. And then the number of assigned monthly hours, or again, if it's something where it's more about half-time status or full-time status, including that status, half-time, full-time, or again, those number of assigned monthly hours, and then ideally a contact person at the volunteer site or the training program or school or, institution of higher education. So again, this just briefly tells you the kind of information that's helpful. Of course, if that that customer can take that documentation and upload it via Manage My Case, again, drop it off at the FCRC. They have multiple different ways to submit that, and you can help them with that submission process as well. But this is sort of the basic information that would be helpful to capture for submitting that documentation request. All right, next slide, please. And I think I will turn it over to Julio for this one.
Yes. So one of the things that we're really looking at is, as we begin to part on this effort, is we're really trying to think about creating not only a pathway to getting folks into these programs that will help benefit them, but also trying to think about how we can really sort of coordinate and align all of the various types of programs, the education, the unemployment, as well as Title I and other services. Um, we are hoping that we will be wrapping up and beginning to start with our virtual strategy relatively soon after the first of the year. We're hoping to launch that probably at least in a phased in approach starting in February, with the idea that we'll use the sort of virtual Illinois WorkNet platform as our mechanism for getting folks into programs. And as we continue to sort of phase up, we'll begin to think about where are there opportunities to, one, help people get to on-site services through the job centers. That could be things like providing, regular orientations on various types of programs, as well as providing specific types of activities that folks can be self-directed on, or that we can provide additional staff support to get folks into the programs. That is something that we're continuing to really look at. So we're trying to, at least initially, reinforce the idea that they're going to be starting with this sort of self-directed virtual type service strategy, with the idea that we'll build on that with more on-site services as we move forward. But the idea is to continue to find ways to meet those work requirements, as well as continue to help people move on to a career path. Because our goal is really stability. Our goal is to really find ways that folks can take advantage of a lot of the programs that we have that really can help provide greater stability, not only around food insecurity, but around employment. So that's where we are right now. Again, we'll continue to provide these types of updates as we progress, just to keep everyone informed and continuing to message to everyone on our efforts. We do have a plan. Uh, we've been developing, we've been meeting with the governor's office and all of our partners to ensure that we're in alignment in terms around our messaging. And really, we want to enlist all of you as we present all this information and materials. We hope that you'll continue to, stay connected to us as we continue to do these efforts. Turning it back to you in
Thank you.
Springfield, since you have the Springfield background.
That's right. Thank you, Julio.
Sure.
And again, as Julio said, we're looking at this change and trying to do what we can to use this moment to come together and both look at how we can launch new programming to serve more ABODs and again, kind of sequence and meet them creatively where they're at, as well as leveraging existing programs. And as Julio said, we have a plan. We are going to be working on convenings and different opportunities to work with you all to further flesh out that plans. Again, with that eye towards what creative, innovative ways do we have to build new things to serve more ABODs, and also, again, building out the ways that we can align, co-enroll, and work together. And as Julio said, both balancing wanting to have enough slots to help ABODs meet, but the long-term goal is to help them to transition off SNAP when they're ready the right way, right? Which is through getting family-sustaining wages and a career path, as opposed to using their 3 months and losing SNAP, which is what we're all really focused on preventing. So again, we are so grateful for all of you who joined us today to be part of this conversation, and just know that there's a lot more to come on this. So next slide, we're going to pause here as well for Q&A. So please go ahead and enter any questions you still have into the Q&A or the chat. We'll give everyone a minute to, I know we've shared a lot of information, so yeah, take a minute and just see if you have any questions, and it could be related to anything that we've covered so far.
We've got one question for Julio.
Sure. Uh, my email is julio.rodriguez@illinois.gov, and I'll put it in the chat as well.
And then I can probably answer the question from Shamir. Um, can you provide the best link through which people can read about this information at any given time? This information will be up on, well, the slideshow and the video will be up on the Illinois Workforce Academy. And then there will be an FAQ document that will be put out afterwards once we get clarification on a few items. Is there anything else that I'm missing in terms of answering that question?
Antonio, I did add to the chat. Well, again, I have this also on, we have a few slides left after the Q&A, but our IDHS Federal Impact Center, that is where we are literally doing daily updates as things may be changing with the federal landscape. So for example, when there was a question around the November benefits, this is the place where we were making those updates. And we have information on, the February time frame for the SNAP work requirement on there. So encourage you all to bookmark that Federal Impact Center link to refer back to it, because anytime there's changes, again, related to anything new on the federal landscape, we'll update it there.
Antonio, will you do me a favor? For some
Yes.
reason, this is not letting me put my email in the chat for some reason. Can you
Yeah,
just put it
absolutely.
on there?
Let me
Thank
just,
you.
All right. And then please clarify if a person is filing for unemployment and they are compliant, they are exempt, correct? So again, one of the exemptions is that the person is applying for unemployment and they're complying, and that would be an exemption. Again, that is something we would have like a data, we do have a data sharing agreement, and that's something definitely the FCRC eligibility worker will be looking at in the system.
and there was another
And
question about, can you go over the 30 hours and the 217.50 again?
yes. So if somebody is employed or self-employed 30 or more hours a week, they are exempt, and they would not be identified as an ABOD. And similarly, there's an exemption based on how much they're earning. So if someone is earning $217.50 a week before taxes and deductions, they would also be exempt. And again, with both of these, the eligibility worker, one of the things to determine eligibility is to find out, is that person employed, how much they're earning, budgeting that income. And so those are all things that would be automatic based on, the worker budgeting that person's income. But so if they are getting $217.50 a week or more, they would be exempt. And I was just flagging that given that our state minimum wage is $15 an hour, really somebody working 60 hours a week at $15 is likely exempt based on their income. And so, just something to keep in mind that if they're earning that much, it doesn't matter how many hours it is. They're meeting simply based on earning the $217.50 a week. Oh, I'm sorry. Thank you for
Yeah.
asking. 60, sorry, not a week. Sorry. There's always the week and the month, and I'm sorry I was Thank you. Thank you. Sorry. I meant 60 hours a month, right?
Yeah.
Yeah. So
Yeah.
go ahead. Go ahead, Julio.
Yeah, I just saw the question about, do we expect an influx of folks going into the WIO training program? So one of the things, and we'll address this at the meeting on the 8th in January. Right now, what we are trying to do, working very closely with Sheena and her team and the DHS workers, is that we're trying to control the flow into the programs. That's why we are starting with virtual services to help mitigate some of that, like people coming into the centers who don't have enough information to really make an informed choice. So we're going to work very closely with DHS to make sure we're trying to control as much as we possibly can the flow of SNAP recipients going into the job centers. Um, but, we can only do as much as we can. When we meet on the 8th, we'll talk a little bit about what our expectations for the job centers are. Um, but that does not prohibit you from, if people do come in and they are eligible for Title I, which they would be as a priority of service, that you assess them and determine the appropriateness for Title I, given that not all of them will be prepared to go to work. So figuring out what's the first program opportunity that makes the most sense based on their need.
All right,
See
there's
one more
another.
question. Yes.
Yes.
Sorry.
So what if they apply for unemployment but are monetarily ineligible but are looking for work? Will they qualify? So again, with all of these sort of nuanced questions, definitely, enc encourage any individuals in those circumstances to work with their eligibility worker to figure it out. But again, the exemption is for applying for unemployment, meeting those work rules, or receiving unemployment. But again, I'm hesitant to give a lot of these nuanced responses because again, I want to encourage people to work with their eligibility worker because their specific circumstances may be unique, and I don't want to give a blanket answer. Again, definitely encourage individuals in situations like that where there's a lot going on to please contact their FCRC in person, over the phone, through Manage My Case, to address those specific nuanced situations. Because again, we want to look at the whole picture. Any other questions? All right, I'll go through the last few slides and then we can definitely pause again to see if there's any last questions. So on the next slide, we're talk about a few ways for you to stay engaged. Again, your partnership is more important than ever, and we want to continue to share updates, tools, and other opportunities to support your work and to help us connect with ABODs. So on the next slide, we have just a list of different ways that you can help us by communicating about these changes, helping them navigate these changes, again, letting them know about that screener tool and other options. Definitely share your feedback on wording on our application or other materials to help us tweak those over time to be more easily understandable. These federal rules are very complicated, as you've heard in the last more than an hour. And so messaging it is really challenging, and definitely you all can help us with that. And also lifting up to myself and Julio and other, of our partners around what challenges that customers are facing, and what you're seeing out there in the community as a result of these policies taking effect. It's always helpful for us to hear that feedback from all of you. Next slide, please. And so I put the link to the Federal Impact Center in the chat, but again, just reiterating that any changes or updates, not only to the work requirement, but to the other changes in HR 1, again, related to payment error rate or non-citizen eligibility, or some of those other things that SNAP Federal Impact Center is a place for you to go, and we're continuously updating it and adding more tools and resources there. All right, next slide, please. All right, so that was it, all of our formal slides. Again, definitely want to pause and see if there's any additional questions. I think we have about 15 more minutes.
Since there's a pause, I just want to iterate for folks who are Title I grantees and providers, we will be doing a webinar on January 8th. We will send that information out to all of you. We're strongly encouraging particularly career planner supervisors, and others who work directly on client services to participate. We'll be able to expound a little bit more on uh, both performance, the priority of service, and other aspects of Title I programming that would be impacted by these new SNAP requirements.
Yeah, I'll just give it maybe one more minute just to see if there's any
Oh,
questions.
there is one in the chat,
Oh,
Sheena.
okay. Can we feel confident that eligibility workers will be well versed so that clients um, don't fall victim to heavily layered information, unintentionally misunderstood? So thank you for that. Thank you for that comment. Those are definitely the ways that you can help lift up to us if you are finding areas where there seems to be confusion or misunderstanding. Again, you can definitely raise those up for us, and we can look for those opportunities to clarify things. I will say again that our eligibility workers are going through a lot of training on this, and something that we are looking at closely on the policy side, but certainly appreciate that feedback from all of you. If there's any areas where you have questions, or you're seeing that there may be some miscommunication or misunderstanding. And, that's part of the reason, like in terms of qualifying work programs and recognized training programs for the half-time exemption, that we are working on that internal alignment and to make it a little bit more clear to avoid those kinds of that kind of confusion or misunderstanding. So I appreciate that feedback. Again, our workers are being trained. We are communicating with customers, but definitely if you are seeing those areas of confusion, please lift those up to your state partners.
Sheena, if you're okay, I just want to add a comment to
Sure.
that. I think one of the things we're also looking at across the board is to provide uh, collateral information that we can produce that can be posted on various places to kind of outline um, key elements of the new policies, so that way you as providers, advocates, and others know that there's information that's available that can help augment those workers. So the more informed we all are, the better, and that we can avoid both confusion and misinformation. That's really the goal of these webinars and other things that we're doing, is to, again, avoid misinformation and confusion, but also to make sure that people understand exactly what helps them meet those requirements, both in terms of exemptions as well as activities.
And we are hoping, as Julio said, to add more of those kinds of resources on the Federal Impact Center. So more to come, as Julio said. And your questions, again, your questions today, the questions from the last webinar, that also is really pointing to places where, it could help to provide that clarification. So really appreciate all of you sharing those questions and that feedback, because that is also helping us as we think through the kinds of materials to put out there for customers and for partners. Maria, so when someone applies for unemployment, they will not be required to look for work unless they are allowed unemployment benefits. This is why the question keeps arising. Sounded like you indicated someone would be exempt once they filed for unemployment. So Maria, again, I am not myself an eligibility worker, right? But I am just sharing with you all the exemption as in our federal policy. But I hear you that it may be that there's different steps behind the scenes. But again, with unemployment, again, I want to assure you that that is one that is a little bit easier, because we have a data sharing agreement with IDES around unemployment. And again, that's where the eligibility workers will be much more versed on, like you're saying, the sequencing and all of that. And so again, myself not being the eligibility worker, unfortunately, I can't speak to those specifics. But again, just know that eligibility workers are in the system. They would have that information. An individual can share kind of their place in the unemployment process. And again, I'll add these to the FAQ for additional, if we can get some additional clarification on all of those different steps for, especially for those of you at IDES who may have those questions. All right. Is there a time limit of how long a person has to look for a job to stay on SNAP? Meaning, can they just stay in a workforce program forever? So again, under our federal rules, there is not a limit in there. An ABOD could be staying in a workforce program over time, and that's as long as they're an ABOD, they're in a workforce program, and that way meeting the work requirement. Again, we all want to work together because we want to help people to advance, to a next step in the career and all of that. But just so you know, the federal rules, there's not a limit on how long an ABOD can be meeting the work requirement. That could be ongoing, that they're doing community service, or ongoing that they're in a work program. Okay, will there be, or are there info sessions given to the ABODs about these changes? So again, from the IDHS perspective, eligibility workers will be explaining the requirements and how to meet and all of that during the interviews with customers, as well as the notice going out with the information. Also, certainly part of us going out and doing presentations is to help partners. And I know we're working with some of our partners as well in terms of sharing information directly with customers as well. So we'll take that back as well as a suggestion for those info sessions. But again, FCRCs, they are required, the eligibility worker, to explain these to the specific household when they're talking with that household via the interview, at initial application, and then through the renewal process. And again, they will get that work rules notice that explains this information as well.
I think one more question. Is there a time limit of how long a person has to look for a job to stay on SNAP? Meaning, can they just stay in a workforce program forever?
And yeah, with that one, there is not a limit on how long someone can be in a workforce program. From this ABOD work requirement perspective, again, not speaking to program design and all of that. Yeah.
Yeah, so just to give an example, so someone might start, let's say, in an adult ed program, finish that program, and then move on to a Title I program to get additional training in a specific career or occupation. They might go into an on-the-job training program. So, ideally, as they get involved in any of these programs, they're working towards the ultimate goal of full-time employment and a career path. So, yeah, and I think we would watch very closely, that people are advancing as best they can, given their capacity and the availability of resources.
Any last questions? All right. Again, really want to thank you for your time and attention today and great questions. We will again follow up with more information related to some of the questions that you asked. Again, I'll do some clarification in terms of that unemployment piece. And so thank you for, helping me understand those various steps, given that, again, since I am not in that seat of determining eligibility, but I will work to see what clarification we can provide on that for you all and the other questions that you shared in the chat. And just again, please encourage you to stay engaged And we are excited to share more information around our coordination and alignment and some of the new initiatives we're launching in the coming weeks. Julio, anything else you also would like to add?
Nope, just again, a reminder about the January 8th webinar that's coming up for those in the Title I programs. And again, as Sheena said, I want to thank all of you for participating and continuing to stay connected to this. We really want to make sure that folks in Illinois have every opportunity to one, make sure they stay on their benefits and also continue to progress to whatever their job or career goals might be. And so we really are encouraged by the work that we're doing right now across agencies. So thank you all again.
Yeah, thank you so much for your partnership and support in serving our ABOD population. Really appreciate it. And I know we'll be engaging with you all very soon. So thank you so much.
Have a great holiday, everybody.
Yes, happy
Have a
holiday
great
season and New
holiday,
Year.
everyone.
Yes.
Have a wonderful day.
Bye-bye.
Thank you. Bye.